Hello Adventist retirees, this is Steve Thurmond with Medigap Tennessee. In this video I'm going to show you how to enroll into a standalone prescription drug plan through the actual AON web portal. I know last year I created a video for you showing you how to use the drug plan finder tool on Medicare.gov. That is still the authority on drug plans. Medicare.gov will show you all the plans available to you in your market. However, AON does not offer all plans available to you in your market, unfortunately. So since you have to pick the plans that AON offers you in order to remain compliant and qualify for the health reimbursement account on an ongoing basis, I figured I'd just create a video for you this year showing you how to use the tools that AON provides. So you can still corroborate what you find in the AON Drug Plan Finder tool with the Medicare.gov Drug Plan Finder tool if you'd like. I've done so. Seems to be pretty accurate across the board as far as comparing the plans you see at AON versus the plans you see at Medicare.gov. The only difference being is that, again, Medicare.gov shows you all of your plans available in the market, whereas the AON tool only shows you what AON offers you. And since you have to pick a product that AON offers, we might as well just use their tool going forward. It'll also save you having to have a phone interview and speak with somebody over the phone, a representative at AON. You can use this tool and enroll yourself into the drug plan coming up for the upcoming year. If you're new to AON, if you're a new retiree and say retiring in the middle of the year or any time of the year, you can also use this video to enroll yourself into the standalone prescription drug plan for the first time as well. And I'll explain those subtle differences here once we get into it. So without further ado, I'm going to show you exactly how to do this. First thing you need to do, obviously you're on your computer if you're seeing this video now, or on a phone perhaps. You're most likely going to want to use a computer to do this. A phone might be a little tedious, but I believe you certainly can use your phone if need be. First thing we'll do is go and open a web browser. Some of you might use Mozilla Firefox, some of you might use Internet Explorer. Some of you might use Google Chrome, that's what I use. If you have a Mac or an Apple product, you might use Safari. Regardless, open a web browser. I'm just going to pull this up. My default page is Google here. Now you don't want to search for this link. You want to use the link that I provided to you in the email that you received. But if you're just watching this video for the first time and you did not receive that email, you want to go up here to the top left corner. In Google Chrome, it's the top left corner of your web browser. This is called your URL space. It's the Universal Resource Locator, also where you type in, manually type in web links. And what we're going to type in here is retiree.aon.com. You can see it's already populated here automatically in my browser because I've been there multiple times. So again, retiree.aon.com/Adventist retirement. It's the same link that I did send you in the email if you have that email handy. So you can simply click on that link in the email. It will also take you to the same space. But if you're doing this manually, typing it in for the first time, retiree.aon.com/Adventist retirement, and simply hit enter. That's going to bring you to the page that you need to be. It's going to bring you where you need to be. You should see the Seventh-day Adventist Church North American Division logo here as soon as you land on that page. If you do not see this logo, go back up here and make sure your URL is correct, your link is correct. retiree.aon.com/Adventist retirement, and it should bring you right to this page. You've got your login up here in the right corner. This is the first place we're going to go. If you've already created an account with AON, you're just going to go here and log in by clicking on this link. If this is your first time visiting this page ever, you may need to set up and create your account. So if this is the very first time you've been here, you need to just simply follow the instructions here. Let's start by filling in your information. Just read through it. First, verify your identity. Please choose one. You can verify your identity by the last 6 of your social. your AON Retiree Health Exchange ID, which you would have received in a letter in the mail. A physical letter in the mail would have given you your AON Retiree Health Exchange ID. You can also create your account that way. Or if you already have a login, you can click on that button and it'll open the login box right there. Easiest thing to do if you already have an account, again, is just click on login here. It brings you to the login page. On the next page, my mother's information here is already populated. So we're just going to go ahead and click login. If your information isn't in there already, simply type in your username that you created and the password that you created. If you forgot your username, click on I forgot my username. If you forgot your password or it needs to be reset, click on I forgot my password, and it will email you out instructions on how to reset those usernames and passwords if need be. We've already got our information in there, so we're just going to click login. It will bring us to the next page. A little slow this morning, I'm not sure why, but we'll let it load. Okay, so here we are in the main page logged in. You can see I'm logged in here under my mother's account, under her AON Exchange ID and her account. You've got a lot of options here. You can simply read over the page if you'd like. The easiest thing to do, remember what we are doing here today, is choosing the best prescription drug plan for you for the upcoming year. So what we're going to go do first is go over here to the far left corner under the AON logo, and we're going to click on where it says Individual Medicare. When we click on that, we've got a drop-down menu that pops up. And what we want to find here is a Medicare plan. It is a Medicare prescription drug plan. Notice it doesn't say that specifically, but it does fall under the Medicare plan category. So we're just going to click that top link there, find a Medicare plan, and it's going to bring us to the next step in the process. We'll wait for this to load. Okay, let's build your coverage profile. Now, some of you may have used this tool already. You may have already plugged in your medications, and if you have a Medicare Advantage plan, you're probably not watching this video, but those of you that do might have a Medicare Advantage plan. You may have used this tool before to pick a Medicare Advantage plan. Remember, if you're my client, you do not have a Medicare Advantage plan. You have Original Medicare and a Medicare Supplement, also called a Medigap plan through me. What you have through AON is a prescription drug plan right here. So what kind of coverage are you looking for? You already have your Medicare supplemental plan through me, so you are not looking for medical coverage. You are looking for a prescription drug plan coverage. So we're going to uncheck that medical coverage box, leave that prescription drug plan box checked, because that's what we are looking for today. What date should your coverage begin? Coverage starts on the 1st of the month. If you are new to AON, if you are a new retiree and this is the first time that you are logging into AON, you will be picking your drug plan for the first time, and you would most likely pick the next available month on the calendar. I'm sending this video out in October of 2018, so if you were a new retiree starting November 1st, 2018, you would obviously pick November 1st, 2018. If you have been with AON and currently have a drug plan through AON, and you are watching this video during the annual election period, AEP, sometimes also called open enrollment, then you're going to be choosing the drug plan for the upcoming year. And so you're going to choose this date right here by default, January 1, 2019. If you're watching this in any other subsequent years, as long as you are making your annual change for the upcoming year, you're going to choose the January 1st upcoming year date there for an effective date. You will be in your current drug plan through the remainder of the year, and then the new drug plan that you choose using this tool will go into effect the following year, January 1st, 2019. So we're going to choose that option there. Please tell us about yourself. We need this information to find plans available to you. If you don't want to answer every question here, you can find plans using the manual plan search. You can certainly do that if you'd like, but if this is the first time you're doing this, you do need to build your ID here. So go ahead and put your date of birth there. Very important, your zip code. You need to put your zip code and where you primarily reside for the majority of the year. Plug in that zip code right there in the zip code space. Pick your gender, and then right here below, select any that apply. This is for my mom's account. She is not disabled, so we're not going to choose that. She does not have end-stage renal disease, so we're not going to choose that. She does not use any tobacco products, so we're not going to choose that either. We're going to click the next button here where it says add medications, and this is the most important part of this step, is adding these medications. So we click on that button there. By adding your medications here on this page, this allows us to choose the best drug plan available for you for your specific medication list. You do not, I've said this many, many times, you probably heard me say it, you do not want to pick a drug plan out of a hat. You want to pick the plan that is specific, that is best and specific to the medications that you currently take. The whole purpose of the annual election period, AEP, is so you can choose the best drug plan in the upcoming year specific to the medications that you are taking. What is the best drug plan for you now may not be the best drug plan for you in the upcoming year, and that's why CMS, the Centers for Medicare and Medicaid Services, gives you this annual election period, also called open enrollment, to change drug plans once a year and get yourself into the best drug plan for the upcoming year. So what we're going to do here is enter your current medications. If you're taking different medications than you were at the beginning of the year, you want to enter all the medications you are currently taking. So we're just going to start here. I'm going to start by plugging in a few of my mom's medications and show you how this works, okay? One of her medications is a simple blood pressure medication called losartan. If you'll notice, if you start typing the name of the medication, it populates down here below in the drop-down box. She actually takes losartan potassium / HCTZ, which is hydrochlorothiazide. So that's the medication she takes. It usually picks the most common default milligram amount for you. So just double check and make sure the milligram amount that's checked already is the one that you're taking. If not, choose a different one. My mother is taking this default milligram amount, 100/25 mg. She gets it filled every 90 days via mail order. And so we choose that every 90 days. And every 90 days she's getting 90 pills, not 30 pills. So we're going to come over here and edit that quantity per refill. 90 pills every 90 days. That's the prescription for this specific medication that she takes. Everything looks good there. We're going to add that medication, and that adds it to her drug list. And you'll notice here, under where it says My Medications, she has one medication added here, losartan potassium hydrochlorothiazide. If you see an error there, if you didn't change the refill amount or the frequency amount, you can go right over here to the Edit button and click on Edit. It'll bring you back here to that medication. You can make any additions or changes you need to make there. And then when you're finished and everything looks good, you simply click Save there, and it will save it. You've got a little plus sign here. You can click on that, and it drops it down and gives you some extra information there as well. If you typed in the wrong medication completely, simply click on the Remove button. It will delete it from your drug list. So we're going to go back up here to the search bar again for medications and put in her next medication. Her next medication is a common cholesterol medication called rosuvastatin. If you just start typing it in, you'll see that it will populate below. If you type it all out and this doesn't populate, you've either made a typo, just go up and double check the spelling, or you may have typed in an over-the-counter medication that is not prescribed. This search tool is only going to show you prescribed medications. So if you're typing in like a vitamin or a simple over-the-counter supplement, it's not going to show up here. These are only going to be prescribed medications that you have to go to the pharmacy for that will populate here when you're typing in. So we're choosing that rosuvastatin calcium as her medication. That pops up. She's taking a 5 milligram tab. She takes that every 90 days. 90 pills every 90 days via mail order. So we're choosing the quantity per refill of 90. Refill frequency is every 90 days. And we're adding that medication to her drug list. So she's got 3 more medications that I'm going to go ahead and add here, but I think you get the gist of it here. So I'm going to go ahead and add those medications. No sense in you watching me do each and every one, so we'll save some time here. But you get the gist of it here. Simply type in your medication in the Search Medications bar. As that medication pops up below, choose that medication, adjust the milligram amount, adjust the refill amount, adjust the frequency amount, and click Add Medication, and do that for each and every one of your medications until you have a full list here below the My Medications tab. So, okay, so I've got my mom's drug list ID or drug list here built out completely. She's taken 5 medications. I have them all listed here to protect her privacy. I've covered the medications here. You saw a couple of them there that were very common medications, no big deal. But I've covered those up, but you can see them here, 5 medications listed. Any edits you need to make, just be sure and double check this before you move forward. Make sure you're taking the right amount. If you're taking a specific medication twice a day, and you're getting it every 90 days, well, that's not going to be 90 refilled every 90 days. That's going to be 180 refilled every 90 days. If you're taking it 3 times a day, you just do the math on it. You know, you just need to make sure you get the amount correct on an ongoing basis. So just double check all the numbers here, and make sure your milligram amount is correct. Make sure your refill amount is correct, and the frequency in which you get those medications is correct. If you're getting them at a local pharmacy, retail, you're not getting the mail order, then you're most likely getting a 30-day supply every month. So 30-day supply every 30 days. Again, just make the adjustments according to what you're taking, and then you should be good to go. How do you prefer to refill your medications? You got 2 options here, either mail order or local pharmacy. That's going to a local retail pharmacy. Mom gets all of her meds via mail order. Typically, it will save you money in that regard. So I do recommend that you use the mail order option if you're okay with that. There are some medications that can cost more via mail order, but those are the exception and not the rule. 9 times out of 10, you're going to get the best savings and price if you get all your medications via mail order. So, okay, we are good to go here. The drug list is built, so we're going to just click the next button here where it says add your provider. Now, add providers, this does not apply to you folks. And the reason being is you folks have a Medicare supplemental plan, also called a Medigap plan through me. The only reason you would need to add a provider is if you had a Medicare Advantage plan, and that's because Medicare Advantage plans have networks. They have HMO and PPO networks that you have to stay in, and that's why you need to enter in your providers here to see if they are in the network. That does not apply to you folks. It does not apply to my mother. She has original Medicare. You have original Medicare. She has a Medicare supplemental plan. You folks have a Medicare supplemental plan. You folks can go to any hospital in the United States that accepts original Medicare, which is about 100% of all hospitals. You can go to any doctor in the United States that accepts original Medicare, which is about 98 to 99% of all doctors in the United States. So there are no networks associated with your Medicare supplemental plan. As long as the doctor accepts original Medicare, the doctor will accept your supplemental plan as well. Remember that a bit of information, very important. So we don't have any coverage needs here because Mom's not in a network and neither are you. So we're just skipping this all together. Just going to skip that. Use of medical services, also something that's not necessary. You see it says here, how many times did you visit your primary care physician in the last 12 months? It doesn't matter. You've got a supplemental plan. You can go 5 times a month or as long as your doctor will see you. You can go as many times as you want. So there's no bearing here on putting in this information. It's not relevant to you since you have original Medicare and a supplemental plan. So there's no point in actually putting in any of this information. You can go to doctors and hospitals as often as you want, and you'll pay no more or no less because you've got original Medicare and a supplemental plan. So we're going to skip this step as well. The only thing that we need here are medications. We need recommendations for medication drug plans. So we don't need to put in providers, we don't need coverage needs, etc. Just the About You section and the medications. The rest you can just skip through without it putting any information. What we want to see here is the recommended plans. We want to view the recommended prescription drug plans. So click on that box right there, that red box. Next page pulls up, and it should show us looking at plans in your area, estimating your out-of-pocket cost, assessing your risk, etc. If you'll notice here that it's already on the default prescription drug plans tab because we do not need medical coverage. You'll notice here you've got Medicare Advantage plan options, you've got supplemental plan options. Feel free to look at the supplemental plans if you'd like. Compare it to what you're currently paying via me, and you can see the savings that you'll have on a monthly basis. But we're not worried about these two tabs here. We want the prescription drug plans only. Now, if you'll notice, based on my mother's medications that she is taking, it has recommended the United Healthcare AARP Medicare RX Walgreens plan as her best plan specific to her medication list for 2019. Remember, these are for the upcoming year. My mother is presently in a WellCare Classic prescription drug plan. She has been on that WellCare Classic prescription drug plan for the last 2 years. Unfortunately, AON is no longer offering WellCare plans in 2019. And that's unfortunate, very unfortunate, because I have checked her medications on Medicare.gov, and the plan that gives her the best coverage is a WellCare plan. It's not the same WellCare plan she has. It's a new WellCare plan that's available in 2019 called the WellCare Value Script Plan. But guess what? AON doesn't offer it. I'm looking at drug plans in the 37411 zip code where my mother lives, right across the street from me. And there are 29, I'm looking at this right now on Medicare.gov, there are 29 drug plans available to her in the 37411 zip code. If you'll notice here, AON only offers 19 of those 29 plans. So there are 10 plans that are not offered by AON in 2019. And the plan that gives her the best coverage, again, is the WellCare Value Script Plan, but it's not an option for her, so she cannot choose that. Very important here, folks. If any of you that are listening to this, if you have a WellCare plan presently, if you've had a WellCare plan in 2017, if you have a WellCare plan in 2018, you will not be able to keep that WellCare plan in 2019, because if you scroll down through the list here, WellCare is not an option that AON offers you. And since you have to have a product from AON that they offer in order to maintain their qualifications for the health reimbursement plan, you've got to choose one of these plans available to you, one of these 19 plans, none of which are a WellCare plan, as you'll see. So, in a perfect world, Mom would be able to move to the WellCare Value Script Plan if AON offered it, and her out-of-pocket cost would be $223 a year for her medications. She'd essentially get her medications for free via mail order. It might cost her a little bit more than that, but she'd basically get her medications for free via mail order with that WellCare Value Script Plan. But that's not an option, so instead, she's got to pay $397 out of her pocket next year for her medications, which is still a reasonable price, but it's not the best price available to her. But we don't have an option here. We have to play by AON's rules. So this is the next best available option, and I have corroborated this plan with Medicare.gov as well, and it is the best next available option to her, and it is her best available option through AON. So this is the plan that we are going to enroll her into today for a January 1st, 2019 effective date. The United Healthcare AARP Medicare RX Walgreens plan. When you plug in all of your medications, it should show you the plan with the highest score here as the top plan. And if you'll notice here, you can sort these plans by different factors. It's set up to sort by score, which is fine. You can sort it by premium. You can sort it by insurer. You can sort it by total cost. If you want to just look at total cost here, the plan that has the lowest estimated out-of-pocket total cost should also give you the highest score as well. So that should be about the same. If you are not taking any medications, if you're taking 0 medications, it does not make sense to overpay for a plan. So you should simply choose the plan that has the lowest monthly premium for 2019. That plan happens to be the Aetna Medicare RX Select plan. A lot of you are currently on that plan. And if you're still not taking any medications, then you're just going to stay on that plan and it will automatically renew in 2019. There's no need to re-enroll into this plan. I repeat, if the plan you are currently on is still the best and lowest out-of-pocket cost for you in 2019, do nothing and that plan will automatically renew for you in 2019. As long as AON offers that plan next year, it will automatically renew next year and you will be qualified for the health reimbursement account going forward. Again, if you have a WellCare plan, AON does not offer any WellCare plans in 2019. You have to pick the next best available option to you. And this is exactly what we're doing for my mother, so this is exactly what you will want to do as well. Now again, my mother's best option is that AARP, United Healthcare, AARP Medicare Rx Walgreens plan. That might not be the best plan for you. You might have one of these other plans that pops up as the best option for you. What you want to focus on here is the total estimated out-of-pocket cost, which for her is $397 for the year. If you'll notice the date here, that cost is from 1/1/2019 to 12/31/2019 for the year, the entire year. And that is her total estimated annual out-of-pocket cost. That $397 includes the monthly premium of $28.10 in that figure. So that's not $397 on top of $28.10 per month. That $28.10 per month is figured into that $397 out-of-pocket cost for the year. So that is the cost of her medications, the cost of the drug plan premium, and it would be the cost of the deductible, but my mom doesn't take any tier 1 or tier 2, my mom doesn't take any tier 3 or 4 or 5 medications. All of her medications are tier 1 and tier 2. And if you'll read here, this plan actually has a $415 deductible, except for zero deductible for drugs listed on the following tiers, tiers 1 and 2. My mom's meds are on tiers 1 and 2, so she gets coverage right out of the gate from prescription 1, number 1, and she does not have to pay that deductible. Don't focus on this deductible, folks. Some of you might have to pay the deductible, others of you might not. But don't focus on that. You want to focus on the total estimated out-of-pocket cost, because this figure includes any deductible, any premium, and any copays for your medications. So if you see a plan and you see that, oh, this one has a deductible, I don't want that plan, well, you're looking at the wrong figure. You need to be looking at the total estimated out-of-pocket cost and not the deductible. If you'll notice here, the cheapest plan in the market that does not have a deductible is this Silver Script Choice Plan. Based on my mother's medications, she could enroll into this plan if she wanted to, and all of her medications would be covered, but they wouldn't be covered as well as that United Healthcare plan, and therefore her total out-of-pocket cost would be $588 instead of $397, because this plan does not cover her medications as well as the other plan. And despite the fact that it doesn't have a deductible, it doesn't matter, because again, this plan doesn't have a deductible for tiers 1 and 2, and that's the medications that she's taking. She's all on tier 1 and tier 2 medications. So this is the best plan for her, and this is the figure you want to focus on. If it comes down to it, and you are looking at two different plans, and there's minimal difference between the two, in other words, if I'm looking at let's say this Mutual of Omaha plan here at $28.80, and the Silver Script plan is $29.60. If your total out-of-pocket cost is really close and comparable, let's compare these two here. Well, that one has zero premium, zero deductible as well. So, if you're looking at two different plans, and they're really close in out-of-pocket cost, and one has a deductible and the other one doesn't, I would choose the one without the deductible in the event that you have to take a new medication that might be on a tier 3 or tier 4, and that way you'll get coverage on that medication from day one on a plan that has no deductible. I know that sounds a little confusing, but hopefully that makes sense to you. Again, if you are looking at two plans and they're close in out-of-pocket, total estimated out-of-pocket cost, and one doesn't have a deductible, choose the one that does not have a deductible, because we don't have a crystal ball. We don't know what our doctors might put us on in the future, and if he does happen to put us on a tier 3 or 4 medication, you want to choose a plan that does not have a deductible, because that tier 3 or 4 medication will be covered by the plan day one without having to pay a deductible first. So I guess you could say mom's kind of rolling the dice here. If doctor put her on a tier 3 or 4 medication, she would have to pay that $415 deductible. But the out-of-pocket cost is significant enough that, you know, she's willing to take that risk, and I would advise her still to go with this plan over the one that does not have a deductible, simply because this one covers her current medications better and has a savings of just under $200 compared to the one with no deductible. So anyway, I've blathered on here. So this is the plan we want to enroll mom into, and again, be sure and choose the plan that's best for you. You can go by the plan score or sort by any other factor you want here, but I'd say you should be sorting by score and total cost. Unless you're taking no medications, you're not taking any medications, you want to sort by premium and simply choose the plan that has the lowest premium per month, which in 2019 through AON is the Aetna Medicare RX Select plan. So, all right, enough of that. Let's go back here and resort by score, and we're going to choose Mom's plan here. So when you decide on the plan, you're confident in your decision. You've got your drug list plugged in accurately, and you're confident this is the plan that's going to work for you. Simply click on Add Plan to Cart right here, this red button. You're going to add plan to cart, and that's going to put it up here. You'll notice here in the top right corner, her cart pops up with a 1 in it. She's got one item in her cart, and that is the drug plan that we are going to enroll her into today. If you want to corroborate this plan that AON has chosen for you, if you want to corroborate the plan with Medicare.gov and you're comfortable using the drug plan finder tool at Medicare.gov, feel free to do so. I found that it is fairly accurate. The numbers line up and everything seems to be accurate when you're comparing AON's drug plan finder tool to Medicare.gov's. Medicare.gov is just going to give you a lot more information. It's going to break down each drug price, the cost, a lot more information. It can be a little overwhelming, so if it's confusing to you, just avoid Medicare.gov and stick with the AON's drug plan finder tool. So, all right. Once you got your drug plan in your cart, you're just going to click on that cart up here in the top right corner, and that's going to take you, this little drop down comes up, you're going to view cart. And once we view that cart, that plan should pop up. All right, there it is. Prescription drug plan is the United Healthcare AARP Medicare RX Walgreens plan. This is the plan that's going to be best for my mom. If you want to view the plan details, you can do this on the previous page as well. Simply click on View Plan Details. It's going to pop up a new page and kind of break down some of the details of the plan. Again, not as comprehensive and detailed as what you'll see on Medicare.gov, but it gives you some basic information on the plan that you have chosen. So feel free to look at that. Your 2018 CMS star rating. These ratings will be changing for 2019. They change every year. So it just kind of breaks it down for you, the out-of-pocket costs and expenses. Mom's plan is, it's very minimal. She's paying essentially $15, looks like every 3 months here for her plan. And she'll have the premium on top of that. So anyway, you can look through this, and it just gives you a lot of extra information on the plan itself. So we're good there. We're going to go back here, go to the back button, to the cart. We're going to go back to the shopping cart, and I'm going to show you exactly how to enroll into the plan from this point going forward. And this way, you don't have to speak with anyone at AON. You don't have to spend an hour and a half on the phone. You're just spending an hour and a half watching this video with me, unfortunately. Sorry about that, but I want to be thorough and make sure you understand how to do this. And once you've done it, it should be fairly easy for you in the future, as it's intuitive and fairly easy to navigate as long as you're just taking your time with it and reading through each step. So we got the plan in her cart. We're done shopping, so we don't need to continue shopping. We want to enroll into this plan right now. So we're going to click on the Enroll Now button. We'd like to make sure our offerings meet your needs. Please tell us if any of these reasons apply to you. Let's see here. We're not going to click any of these. We're just going to continue to enrollment here. Oh, I'm sorry, I didn't read the heading. It looks like you decided not to add a dental or vision plan. Most of you have dental and vision and hearing through Sharp. It's far superior coverage to what AON would ever offer you, so no need to add any of that. They're going to want to try to upsell you at every turn here because it makes them money. So we are not interested in any of that, so we're going to click Not Interested and continue to enrollment into the drug plan. Wait for this page to load. Okay, now we're at the AON Retiree Health Exchange Checkout Overview. Just read through it, go line by line, make sure everything looks accurate. My coverage card, This is the plan that we want to enroll mom into for 2019. Before we get started, it takes about 20 minutes to get through the enrollment application. You can save and exit at any time. We recommend gathering the following information ahead of time to help expedite the process. Yes, I concur. You want to have your red, white, and blue Medicare card handy. You want to have any banking information handy if you're doing a bank draft. If you are receiving a Social Security check, I recommend the drug plan being a deduction from your Social Security check each and every month. And that's because if you choose a Social Security check deduction, AON will automatically reimburse you to your checking account that you have on file once it's deducted from your Social Security check. So you're just taking it out of one pocket, AON's putting it right back in the other each and every month, as long as you have funds in your health reimbursement account. So just verify the information: mom's date of birth, gender, zip code, county she lives in, she does not smoke. Your Medicare card, Medicare's Part A and B effective date. Mom has not received her new red, white, and blue Medicare card with her new number on it, so we're going to be using her old card. And you can use your old card information up to January 1st, 2020. So no problem there. So just read through everything. The most recent insurance card. After you complete the application, after you complete an application, you will need to sign it either online or by calling us. We do this to make sure your application is complete and ready to be sent. I understand that I'm entering information to be used in an application process for AON, and this is not a guarantee of enrollment or online enrollment. I also agree that I have received and reviewed the plan summary of benefits. Yes, we've reviewed the plan summary of benefits and all applicable documents needed to enroll into this plan for mom. So check that box and start the enrollment application right there. Click that red box. Now this is all self-explanatory from this point forward. You're just going to walk through this application. You're enrolling into the mom is, in mom's case, she's enrolling into the United Healthcare AARP Medicare RX Walgreens plan through AON. And by doing so, it makes sure that AON is the agent of record. As long as they are the agent of record, then she qualifies for the health reimbursement account because it meets that requirement of her having to have at least one product through AON. So we're going through the basic information: eligibility, current coverage, billing, review, and we'll digitally sign her application and be finished at that point. So who is completing this application? Well, I am helping mother complete it, so she's here with me enrolling into the application, but I'm helping her go through the process. So we're just going to choose I'm completing the application for myself. Miss Judy G. Thurman, that is correct. A lot of this information should be populated since you've built your profile online with AON. Right here is where we're going to enter her Medicare number. Remember, if you've got an old a card, it will still work just fine. So don't worry about that. If you have a new card, though, you do want to punch in the new Medicare card, MBI, which is the Medicare Beneficiary Identifier. Right now, we're going to use her old card, which is simply her social with the letter A on the end of it. So we plug that in right there. The plan's effective date is, her Part A effective date is 12/1/2010. Her Part B effective date is 12/1/2010. That is accurate. That's when she turned 65. Her contact information, putting your phone number there, whether it's phone, whether it's mobile, home, work, friend or family, etc. Choose that drop down. Would you prefer to receive your materials in English or any other language? So we want English. You can choose any other language if need be. Is it okay to email you plan documents, notices, disclosure information, and educational updates? Yes, we're going to choose that's okay to do that and put in your email address there. If you don't want to receive anything by email, simply choose the no option, and you won't get anything via email. Enter the complete permanent home address, including your city, state, zip, and county. So mom's address, personal address is in there right there. Street number, name, city, zip code, county, state. Do you have a mailing address that is different from your permanent home address? No. We're going to choose no on that. She gets her mail at her home. We're going to choose the next option here. Go to the next step. It says, we've noticed a few issues. In order to continue, please review and update your answers. I'm not sure what is missing here, but let's see what is highlighted, if something is highlighted. It's not accepting the Medicare number as I typed it in. because I put in hyphens between the social. So I'm going to remove those hyphens, remove any hyphens that might be in your social, and just type it out straight, your MIB number. In fact, if you have one of the new cards, don't put in the hyphens in there either. Just type out the letters and numbers as it is written. So let's try this again and see if it goes through this time without a hitch. Yep, no problem there. So it goes to the next step here, eligibility. Are you new to Medicare? No. So you need to answer each one of these questions on this list. Just go down the list. She's not new to Medicare. She is not turning 65. That one does not apply. That one does not apply either. Now this one, if you're a new retiree to AON, if you're new to AON and you've recently retired with the church, this one may be a yes answer for you. If you're losing or leaving the group coverage that you had with the church or your employer, you would actually type yes here and type in the date that coverage is ending, because that grants you the special election period if you needed your drug plan to start, say, in November 1st instead of January 1st, 2019. You need a November 1st effective date because you're losing your coverage from your group coverage from the church November 1st. So you would choose yes there. That does not apply to mom. So for the vast majority of you watching this video, you're watching it during your annual election period, which is the next option here. You are enrolling during the annual enrollment period, October 15th through December 7th. Yes. Now by choosing this, it automatically makes your default effective date for your new drug plan January 1 of the upcoming year. In this case, January 1, 2019. So that is the one that applies to mom here. All other answers should be no. If you've chosen one yes, that's all you need for eligibility. So we can just go down through the rest of these and check no. You want to choose the one that's most exemplary of your situation, the one that's most appropriate and most that pertains the most to your specific situation, whether that's changing drug plans during AEP, the annual enrollment period, or whether you've just retired and leaving the group coverage and moving over to AON for your coverage. So none of these others will apply to her. But read down through each of them and just try to answer them to the best of your ability. None of those apply, so we're going to go ahead and go next here. Your what might apply to you might be different, so you do want to read down through each one of those and answer them appropriately. All right, we're here on the current coverage. Will you have drug coverage with this when this plan becomes effective? For example, we have other drug coverage, so no, that we will not have any other drug coverage once this plan right here becomes effective. That will be our only drug coverage, so we do not have other drug coverage. She is not a resident in a long-term care facility, and she does not get any help from the state in the form of Medicaid. So no to all three of those. Click next. Billing preference. Read through all of this and choose one from the drop-down. Mom likes hers coming right out of her Social Security check before it hits, so that's the option she is going to choose, a Social Security check deduction. If you are not receiving Social Security yet, your only other option here is going to be direct bill. They usually would give you a bank draft option, but AON's not offering that here, so your only other option would be essentially direct bill. If you have some kind of electronic fund transfer option, it may differ per plan, it may differ per zip code. So if you've got an option there to plug in banking information and do it as electronic funds transfer each and every month, I would choose that, or just simply choose the direct bill option. Mom wants it as a Social Security check deduction because that's the most convenient. They deduct that $28.10 for the plan each month from her Social Security check, and then AON deposits it right back into her checking account via the health reimbursement account automatic reimbursement option. So Social Security check, we're going to click next there. And review. We're just going to review it now. I want to save that. So let's just review everything here and make sure that it looks good. Birth date looks good. Gender looks good. Zip code's good. County she lives in is good. Begin date, very important. Very important. If you're a new retiree and you need that the drug plan starting for you sooner than January 1st, then you need to make sure that that date that you want it to start is accurate there. For the rest of you that are making a change during the annual election period, this should all read January 1, 2019. If you're watching this in a subsequent year, it's going to be January 1 of whatever upcoming year it is. So just go down through everything. All looks good. Make sure your social or your Medicare ID number is right. Make sure the Part A and B effective date's right. Phone number's right. Billing address, email address, place of residence, eligibility. Make sure all that's right. This is just a review of everything we've just done. And that is it. We're going to submit the application here. Click on that Submit Application button. And it brings us to the signature process here. So that's essentially it in a nutshell. Once this pops up here, we'll see the signature option. Let's see, review the application. Let's scroll on down here to the bottom. It makes you look at it again. Okay, next step is the agreements. And then AON goes through their little spiel of disclaimers and what have you here. All the legalese stuff that they have to tell you about. A little slow today, but that's okay. Again, if it just doesn't, if it looks odd, just scroll all the way to the bottom, and you'll see your next available option here. Before you sign electronically, you will need to read over the terms of this agreement in this section below. When you're done, click on the next button at the bottom of the page. So there are the terms right here. We've already been through all this. Mom's already read it, so we're going to go click on Next. Signature is the next option. And wait for that to populate. Summary and signature. You're almost done. In order to process this application with the insurer, we need you to sign and give us permission using your electronic signature. This next step is to read and verify that the information below is correct. After that, type in your name and click the Submit button at the bottom of the page. Check on all the acknowledgments. I have read and completed this application. I understand and agree to the agreements. I have reviewed and understand and agree to the Medicare plan disclaimer information above. By checking this box, I agree and understand that my electronic signature or the electronic signature of the person authorized to act on my behalf under the laws of the state where I live on this application means that I understand the contents of this application. If signed by an authorized individual, the signature certifies that this person is authorized under state law to complete this enrollment, and documentation of this authority is available upon request from Medicare. We're checking all four of those boxes, and I'll get Mom here to go ahead and sign this and complete it. So this is the very last part of it. This is the end of it. I'm going to pause here, have Mom come in and sign this so we can get it submitted. I'll be right back. Okay, Mom has entered her information here. Today's date is 10/21/2018. She typed in her information here in the boxes to sign off on this drug plan enrollment for January 1st, 2019. Last step here, last thing you need to do is simply click on Submit Signature. That's it. Signature is submitted, application is submitted, and you've got a confirmation here, right here. Your application has been submitted. Thank you. You have successfully submitted the following application. Go ahead and write down that reference application number. I would write that down in case you ever have to discuss this in further detail with AON in the future. You'll have a reference number for this specific application. But that is it. By enrolling into your new plan for the upcoming year, it will automatically disenroll you from your current plan. You do not need to call your current plan and cancel it. You do not need to call AON and cancel your current plan. By enrolling into the new plan for 2019, it automatically disenrolls you from your current plan effective January 1st, 2019. You'll simply change from one plan to the other at midnight on January 1st. So there's no other steps that you need to do. Just watch your mailbox for your new welcome packet and your new card. If you've gone through this process and you realize that the plan that you currently have is still the best plan for you in 2019, do nothing. You're not going to submit a new application. You're not going to re-enroll into the same plan. The current plan you have will automatically renew next year. There's nothing you need to do. You don't need to go through any of this process if the current plan you have in 2018 is still the best plan for you in 2019. So do not resubmit a new application. I repeat, if the plan that you're in is the best plan for you in the upcoming year, do nothing and your current plan will automatically renew for 2019. The exception to that being is if you have a WellCare plan with AON presently, WellCare is not being offered by AON in 2019, so you have to change plans to the next available option, just like my mother's current situation here that we did for her. So, but that is it. I hope this helps you out. I know it's a lengthy video. I apologize for that, but it's a pretty quick and easy process. This avoids you having to have a conversation with the rep at AON and getting further confused or having them try to pitch you and sell you other stuff that you don't need. When you're done here, check your email. You should get confirmation in your email. They are reviewing the application. What happens is we submit this information through AON. AON sends it up to, in my mom's case, it sends it up to United Healthcare AARP, to her new drug plan provider. AARP verifies it, sends it up the chain of command to CMS, the Centers for Medicare and Medicaid Services. They stamp it approved. It goes into effect on January 1st. But you can continue here if you want. Just simply go to my coverage and look at the coverage that you have. There's things for review there if you'd like. But that's it. Of course, if you're intimidated by doing this, that's what I'm here for. Reach out to me. I can walk you through this process, and we can do this together. I have no problem doing that for you. That's what I'm here for. I want you to rely on me if you've got questions, concerns, any hiccups in this process. Just pick up the phone and give me a call. You always have access to AON, and if you don't want to do this online, you're going to have to speak with AON to get this done. Unfortunately, I can't enroll you over the phone. I can walk you through this process while you do it yourself, but I can't do it for you. So you're eventually going to have to deal with AON each and every year on an ongoing basis when it comes to your prescription drug plan. Hope this finds you folks doing well. Reach out if you've got questions. I am here to help, and I hope you enjoy the holidays coming up. A wonderful Thanksgiving, Christmas, Happy New Year to you folks, and I will be in touch, of course, again in the near future. Say hi and reach out if you need me. Take care. Bye-bye.